your health is a top priority.
Being in touch with your body and knowing the difference between if something's wrong and something's not right.
Women are often stuck navigating the stigma.
Actually talking about women's health issues feels very taboo and kind of embarrassing to talk about.
And with all the noise online, they're left trying to tell fact from fiction.
There is a lot of false information on social media, so kind of sorting through what is correct and what's just not true at all.
11 Alive is here to help you take control of your well-being in this edition of Women's Health Verified.
Thank you for joining us for this special edition of 11 Alive Women's Health Verified. I'm Paola Lucero. The month of May is used to recognize women's health. And between what you're taught in school, taught by your mother, your friends, and of course everything you read online, well, it can be confusing to figure out what's actually true. Over the next half hour, we are giving you just the facts about your health from a diverse panel of female experts. Let's start with a topic making its way across social media, claiming Black women are more likely to suffer from painful fibroids. Here's Faith Jesse to verify.
Our sources are Dr. Madeline Sutton, a board-certified OBGYN at Grady Hospital and faculty member with Morehouse School of Medicine, Mayo Clinic, and a study published by the American Journal of Obstetrics and Gynecology. Let's start with what fibroids actually are. According to the Mayo Clinic, uterine fibroids are non-cancerous growths, which often appear during your childbearing years. Most don't cause problems and never develop into cancer.
Most people, if they do have fibroids, they're often very small.
If symptoms do occur, it can appear as heavy menstrual bleeding or pelvic pain, among others.
So the very first thing you should do if you think you might have some pelvic pain or your cycle is heavier than usual or you're bleeding in between periods, anything like that, I would definitely say reach out to your provider.
According to a study published by the American Journal of Obstetrics and Gynecology, while most women will get them by age 50, fibroids are more common and more severe among African American women. Dr. Sutton weighed in, saying it's important to talk with your healthcare provider about your treatment options.
They might be avoiding their provider because they don't want to have a hysterectomy. But a hysterectomy is not the only treatment for fibroids. There are so many other options out there. So I just don't want people to walk feeling miserable or bleeding or having pain. So don't suffer in silence. Come on in and talk with your provider about the different options that are out there.
Right now, researchers across the world are working to find out why painful fibroids are more likely to happen to Black women. One study, Black Women's Health Study, suggests diet could play a role. Another recent study links lack of vitamin D with increased risk in Black women. The Black Women's Health Study also suggests that Black women waited substantially longer than white women before seeking treatment, which can lead to more severe cases and more expensive medical treatments like surgery. About 42 per 1,000 women who are hospitalized each year are because of fibroids, with Black women accounting for a majority of the cases. So we can verify, yes, Black women are more likely to be diagnosed with fibroids than white women, and health experts recommend maintaining a healthy weight and eating well could decrease your fibroid risk.
That was Faith Jesse reporting. Right now in Georgia, it is still legal for you to buy emergency contraceptives, also known as Plan B. But there is some confusion about if this medication actually works during your cycle.
Plan B won't work or will be far less effective if you take it while you are currently ovulating or have already ovulated.
So we set out to verify, does Plan B work during ovulation? Here's Jennifer Bellamy with just the facts.
Our sources are Dr. Ann Beasley, a board-certified OBGYN at Atlanta Obstetrics and Gynecology Associates, Planned Parenthood, and Plan B One Step. Now, to understand how emergency contraceptives worked, we asked Dr. Beasley. She says it has to do with a woman's cycle and a surge in a hormone called luteinizing. Emergency contraceptives work to stop that.
Those actually are preventing or inhibiting that LH surge. So Plan B is really only effective before the LH surge has occurred. And so if that's already happened, it's not going to be effective in that situation.
Plan B One Step's website says something similar. Taking what's considered a morning after pill works to temporarily delay a woman's ovulation, meaning there can be no fertilization, no pregnancy. The company also says you need to take the pill within 72 hours after unprotected sex, and the sooner you take it, the better it will work.
So the best thing to do is going to be to take it as soon as you've had unprotected intercourse. That's going to increase the likelihood that that LH surge hasn't occurred yet. And really it's going to be effective, FDA studies show for up to 3 days following unprotected intercourse, potentially even longer in some studies, up to 5 days.
Now, there are some other emergency options that can also prevent pregnancy. According to Planned Parenthood, a copper IUD, if placed within 5 days of unprotected sex, is the most effective and can stay for up to 10 years. A hormonal IUD, if used within 5 days, works the same way. Both can be provided by a doctor. So we can verify it's true. Plan B does not work during ovulation. It merely delays it. There are other alternative contraceptives that could work to prevent a pregnancy, but for your best option, you should reach out to your healthcare provider.
Well, we know breastfeeding is full of benefits for newborns, giving them antibodies they need to build immunity. New reports claim this practice can give some benefits to mamas too, saying it could prevent cancer. So is this true? Liza Lucas asks the experts.
Let's verify. Can breastfeeding lower a woman's risk for breast cancer? Our sources include Dr. Karen Knutson, the head of the American Cancer Society, nurse practitioner Lori Plummer with the Helen Carlos High Risk Breast Clinic at Piedmont Hospital, and the Centers for Disease Control and Prevention.
Breastfeeding does, in fact, lower breast cancer risk.
Turns out there is a lot of research to back up how breastfeeding can reduce a woman's risk for certain types of cancers, including breast cancer. And while there's no absolute time period for how long you must breastfeed to get the benefit, experts say the longer the time, the greater the protection.
There's been a number of studies that have shown for every 12 months a woman breastfeeds, she can lower her risk of breast cancer by 4%.
That can mean 12 consecutive months of breastfeeding with one child or over several children. The benefit even more significant in some of the more aggressive types of breast cancer.
Some studies have shown up to a 20% risk reduction for these aggressive estrogen receptor negative breast cancers, including triple negative breast cancer.
Researchers believe it comes down to the hormonal changes happening with lactation. Ultimately, that process reduces the woman's lifetime exposure to certain hormones, which are linked to an increased risk of breast and ovarian cancer. The loss of breast tissue when breastfeeding could also play a role.
Losing some cells during that process, which may have started on their journey toward becoming cancerous, may be lost in that process. So you're essentially losing precancerous cells during that time.
So yes, it's true. Breastfeeding not only benefits babies, it also can lower a woman's breast cancer risk. And the longer you breastfeed, the more protection you potentially gain.
Now, experts say there are other ways to protect yourself from these types of cancers, like staying physically active, reducing smoking and alcohol, and maintaining a healthy diet. All of these are good for your overall health, but doctors say it is especially critical to cut down your chance of breast cancer. Well, next on Women's Health Verified, there's a 1 in 8 chance a woman will develop breast cancer in her lifetime. But for many women, there are still a lot of questions.
I think women aren't aware enough about breast cancer. Let's talk about that.
We're taking your concerns to get you just the facts next. In honor of Women's Health Month, we are bringing you the facts to keep you healthy and keep you safe. And today we're talking all about breast cancer. The CDC says it is the most common cancer that is impacting women nowadays. And while it is talked about a lot, there's still so much that we don't know. There are common misconceptions. There's misinformation out there as well. So to verify a lot of questions that you may have, we are bringing in now Dr. Sujatha Reddy with us, 11 Alive's medical expert. Dr. Reddy, thank you so much for being here today.
Happy to be here. Thank you.
Well, let's get right to it because there are a lot of questions out there. So first of all, who is most at risk for getting breast cancer, and how do you even know your risks in the first place?
Great question. Good place to start. So one of the biggest risk factors for breast cancer is increasing age. So as you get older, that risk does go up. There are other risk factors as well. Family history being one. Certain medical conditions can increase your risk. Certain genetic conditions can increase your risk. The best way for you to know your risk is to discuss it with your healthcare provider and find out what strategies, risk prevention, early detection strategies may apply or be good for you to take part in.
Amazing. And, a big part of this is also genetic testing. It's something that a lot of people are not very aware of. So when should you get tested, and what genes should you get tested for?
Another great question. So, it's not something that you're probably going to know as to if you qualify by the criteria that are out there. You may not even know what genes you should be tested for. One thing to do is talk to your healthcare provider again, perhaps ask for a referral to a genetic counselor. Some genes that are common that people may have heard of are the BRCA1 and 2 mutations, something called CHEK, another common one is ATM, but there's several out there. So if you have a strong family history, specifically of women that are younger or even men in your family that have breast cancer, other cancers can link to it too, like ovarian cancer. So, genetic counselors, physicians, healthcare providers will look at your whole family history, identify who puts you at higher risk if they're in your family and have cancer, what kinds of cancer, what age they were. All of that comes into play. And to get it covered by insurance, there are certain criteria you have to meet. If you satisfy those criteria, getting tested is an option for you. Not everybody qualifies or is going to want to get tested because some people are fearful of knowing, or maybe they're not ready to have that information. And I think it's something you have to ask yourself. If you find out you are at high risk for, let's say, breast cancer, what does that mean for you? It doesn't mean you have to have major surgery like having both breasts removed. You may then qualify for insurance-covered MRIs, which are a very improved screening over a routine mammogram for high-risk people. They're not for everybody. So just because you have the gene doesn't mean you have to make major life decisions. You may then get better testing. So getting tested for the genetics is actually a very complicated decision. I think it's very important. I think it's a very useful tool that we have, but it's something that should be discussed with a healthcare provider, possibly even a genetic counselor.
Speaking to your doctor, that should be number one. That's interesting what you said about the insurance, that not everyone can qualify for it.
Yeah, so you have to meet certain criteria and be at high enough risk to get tested. And very often when I talk about this with my patients, if they have, let's say, a mother or a sister who was diagnosed with breast cancer at a very young age, let's say at 39 or 40, they ask, should they get tested? One thing I suggest is it's often best to test the person who had the disease. So if the mom or the sister who had the cancer at a young age is still alive, it makes sense to get them tested, because if they don't carry one of these genetic mutations, odds are the relative isn't going to carry it either. If they do carry it, then it becomes a lot easier to test, because you just test for whatever gene mutation they have. It becomes far more cost effective and often an easier test to run.
Of course. And you mentioned CHEK2 gene. So what is that for anyone who maybe doesn't know very much about it? And who should get tested for that specific gene?
So there is several genes that we know are associated with a higher risk of different kinds of cancers. What we're talking about is the BRCA1, or you asked about CHEK2. These genes are actually there to help identify abnormal cells. When you have a mutation in those genes, when they don't work well, that puts that person at a higher risk for certain cancers. So if someone has a relative who has CHEK2 specifically, then they should probably get tested for CHEK2. Often we don't know the specific gene, and that's why they will check for several, and that's where you can find out specifically what gene may run in your family.
Perfect. How often are mammograms needed?
So the frequency and timing of mammograms depends on the person's age and their history. For someone who has a family history of a young person with breast cancer, we might suggest doing them 10 years prior to that relative's diagnosis. So if they were diagnosed at 40, we might start at 30, but it really varies person to person.
That's a good timeline to keep in mind. And the FDA did set new mammogram standards now. So what does this mean for women right now?
So on mammogram reports, a lot of people are asking about this category where it says that, you have dense breasts, and further testing may be necessary if available, however they're phrasing it. The dense breast tissue is something you cannot change, and it's been that way your whole life. And I find it's sometimes very frustrating for patients because they're being told this, but there's not a lot you can do about it. For some patients, they may need further testing. Unfortunately, that's not always covered by insurance, and it may not always be necessary. I think it's just telling us that if you do have dense breasts, mammograms are going to be somewhat limited in their utility. Now, I think mammograms are still the best thing out there, and I strongly recommend them at the interval that your healthcare provider recommends. But if you have dense breasts, you may want to really stay on top of all your screenings, which are self-breast exams, annual clinical breast exams with a provider, and your mammograms as recommended. You probably are a person that doesn't want to kind of fall off the mammogram wagon.
Absolutely, so important. Any other prevention methods that you think we should mention?
So, you can't control your genetics, but you can control the factors in your life. And some things that can absolutely decrease your risk for breast cancer are being physically active, eating a healthy diet, maintaining a healthy weight. Those are things we have in our control, and those are risk factors for breast cancer. So if you want to optimize and decrease your risk for breast cancer, start with the things you can control.
Perfect, great advice there. And there are a lot of rumors out there that we want to dispel because it is important to know, is this true? Is this not true? So can you help us verify some facts? First one, breast cancer only occurs in middle-aged and older women.
Yeah, not true. While the majority of breast cancers are in middle-aged or older women, about 9 to 10% are in women under 45.
Okay. Second, if you don't have a family history of breast cancer, your chances of getting it are low.
Also not true. So about 10% of breast cancer is felt to be genetic or familial. The rest of it is felt to be what we call de novo, or just a new cancer cell that was created. So yes, family history is one risk factor, but by no means should someone without a family history think they're in the clear.
And this is another one we've heard, wearing a bra too tight can lead to getting breast cancer.
Absolutely not true. No data to support that.
What about deodorant, antiperspirants? We've heard of some people saying, I want to use deodorant that maybe doesn't use aluminum.
Also not true. There's no data that supports that aluminum-based antiperspirants increase your risk. So feel free, if you want to use them, use them.
Okay, great information to know. And if you test positive for breast cancer, all treatment is the same.
Also not true. So treatment for breast cancer has come a long way, and we're doing really well. We always have room for improvement. But how you treat breast cancer is going to depend on the person's cell type, the specific type of breast cancer, how abnormal each cell is, and what stage the cancer is diagnosed at. Treatment really is individual based on all those factors.
I was going to say everyone's situation is completely different.
100%. Risk factors come into play there too.
Okay. Well, Dr. Reddy, thank you so much for joining us and for giving us your expertise on this very important topic. Still ahead on Women's Health Verified, from your personal hygiene products to the impacts birth control could have on your health. It's a lot of information and misinformation. Plus,
there's a lot of theories that estrogen actually promotes or allows cancer cells to grow more quickly.
Can your birth control increase your risk of developing breast cancer? We take a closer look into these claims coming up next. Welcome back to Women's Health Verified. According to the CDC, about 264,000 women are diagnosed with breast cancer each year. Some reports claim there could be a link between your birth control medication and this type of cancer. So is this true? Can birth control increase your risk? We verify. Is birth control linked to breast cancer? Our sources are 11 Alive medical expert Dr. Sujatha Reddy and breast cancer organization, the Susan G. Komen Foundation.
So there's a lot of theories that estrogen actually promotes or allows cancer cells to grow more quickly.
Dr. Reddy says several studies have shown there is a link between the two.
Most healthcare providers have accepted that there might be a little bit of a risk if you take hormones as far as breast cancer down the road. The thing you have to weigh, though, is would a pregnancy increase that risk?
According to the Susan G. Komen Foundation, studies have shown that while women are taking birth control pills, their breast cancer risk is 20 to 30% higher compared to women who have never taken the pill. But as Dr. Reddy explains, your age while taking the medication and the length of time you take contraceptives for also plays a role.
The younger you are, the safer it will be because your risk is small for breast cancer at a young age anyway. The longer you're off the pill, that risk does seem to abate or go away.
The Susan G. Komen organization adds that once women stop taking birth control pills, their risk starts decreasing, and that after 5 years, the risk for breast cancer is similar to women who have never taken the pill. And while studies have shown the risk of getting breast cancer due to the pill, Dr. Reddy says it's important to note the benefits as well.
We have known for many years that birth control, be it pills or IUDs, seem to decrease a woman's risk for ovarian cancer and uterine cancer.
So we can verify, yes, women taking birth control pills have a small increased risk of getting breast cancer. However, birth control pills and IUDs also help decrease the risk of other cancers.
And another women's health product is rumored to cause harm. TikTok and Instagram videos claim a chemical in tampons called titanium dioxide can impact your reproductive health. Jennifer Bellamy set out to verify.
Our sources are the American College of Obstetricians and Gynecologists, the American Chemistry Council, Tampax, and 11 Alive's medical expert, Dr. Sujatha Reddy. Here's what we found. Titanium dioxide is white in color, and it's used to enhance the color of certain foods and everyday products, including some brands of tampons. According to Tampax, one of the major manufacturers of tampons, the ingredient is used to make the thread used in the product look whiter. The American Chemistry Council looked at studies conducted on rats. The animals were exposed to titanium dioxide through inhalation, and some developed cancerous tumors in their lungs. But humans are not exposed to the chemicals in tampons the same way. According to the International Agency for Research on Cancer, extensive studies on titanium dioxide industry workers do not suggest an association between occupational exposure to titanium dioxide and an increased risk for cancer in humans. Dr. Reddy says you shouldn't be concerned.
There's been no documented cases of anything happening because of the titanium dioxide in tampons. So I think women should not worry about that.
So we can verify, no, there is no evidence that titanium dioxide in tampons causes reproductive harm.
That's what I would suggest to women. Just listen to yourself. A lot of women, we don't do that. We always thinking about everything else.
Go to your regular checkups and get your stuff checked out regularly, like from your breast to your knees. I don't care. Like, just get everything checked out.
I'd say find a really good women-centric gynecologist or health practice. Do your research. Find one that's focused on women.
All great advice. Do your research. Speak to your doctor if you have any health-related questions. Well, thank you so much for joining us for this special edition of 11 Alive Women's Health Verified. Our Verify team is here to answer your questions and debunk any claims you see online. If there is something you want us to look into, send it to us at verify@11alive.com.